Do most people make it through, or what percentage would you say?
90% or more. I'm happy if they're with us 2 years. Because of the market and ability of people to go wherever they want to go in this day and age, and I think with this generation, they're more mobile.
Do you hire new grads in your ICU?
We do, and we've been doing it now probably for about 10 years. And so we've developed what I think is a pretty good program. We have a pretty good feel of those nurses that can jump right into the critical care unit. Otherwise, we offer to start them in the progressive care unit, which is our step-down unit, and then we will move them in. But basically, their orientations are going to be the same as they all complete the Essentials of Critical Care Orientation modules from Aacn.
What types of things are you looking for in new grads?
One big thing is passion. Is this really what they want to go into?
How long does the whole process of orientation take?
Anywhere from 4 to 6 months. It's a hard orientation because they're coming out of nursing school as a new graduate, and they have all of the basic fundamental things that they need to practice and learn, as well as all of the advanced practices. Part of it is using the ECCO modules that Aacn provides, and now that they're electronic, it makes it even more easier to use. And we do what's called a blended learning concept, in that they do the online modules. They have classroom time with me that we go over different topic areas to try to build their critical thinking skills. They have to go through a basic dysrhythmia 8-week course. They have to take ACLS. Of course, the most important thing is just the hands-on patient care with a preceptor. They're not going to be perfect when they get out of orientation. None of us were. But we have an ongoing support system that we built into it. So once they get officially off orientation, they still have mentors and people that follow up with them. I follow up with them a lot. Our manager does.
What about training for experienced nurses who have their experience elsewhere? Do you custom fit the rest of your training for them?
Definitely. I think that's part of the success of an orientation program, is to be flexible enough to provide the orientee with what they need. We've had people that have come in that have worked in nursing homes. If they've been pretty strong med-surg experience, then I might tailor them the number they have to do based on where they worked in the med-surg environment. And even if we don't require them for their orientation to complete every single module of ECCO, I still PR to them that this is an online critical care course, so I encourage you to complete all the modules.
Do you schedule your orientations at certain times?
It's flexible. I flex my time for when we hire. Of course, we hire the new grads mostly in December and in May, when we have 3 nursing schools locally, a BSN program and 2 ADM programs. But then if we get someone from maybe a different state that wants to work with us, we'll do orientation whenever.
How do you evaluate the impact of that?
It's how they perform, and are they able to grasp the concepts that are provided in the ECCO modules with putting it into practice? Does it help them to build their critical thinking skills, so when they've got this complex patient, are they able to bring in all of the essentials in the assessment of that patient, not just the physical assessment, which I think is the most important, but also bringing in the labs and the medications and how all of those are affecting the patient, and really critically think what's going on. So for me, it's really, how are they doing on the job? Are they putting that knowledge that they've learned into practice?